WWT presents Experts.
Hello, everyone, and welcome to another episode of WWT Experts. I'm your host, Matthew Coble, as always. And today we have with us two experts from WWT in this episode of our four-part series about healthcare and how that industry is approaching topics like artificial intelligence, digital transformation, security, and in this case, today's topic, cloud. So with me today are Dr. Sanaz Cordes and Jack French. Dr. Cordes started her career as a physician and is now a chief healthcare advisor with Worldwide Technology. In her role with us, she consults with healthcare and life sciences organizations from the biggest clients in the industry down to tech startups and everything in between. And she's really talking to them about all the technologies that are driving the healthcare industry. Jack French is the Senior Director of Cloud Platforms at Worldwide Technology and leads our clients to navigate the complexities of the newer cloud marketplaces that are out there, and of course helps with different cloud environments and architectures, whether that's public cloud, private cloud, hybrid, or anything in between. Delighted to have them both with us today, so please welcome Sanaz and Jack. Hey there.
Hi, thanks for having us.
Yeah, hey Matt, thanks.
Yeah, thank you all for coming. Well, let's jump in. So, Dr. Cordes, WWT works with hundreds of clients across many different industries, and each of them are looking at are in varying levels of maturity as it relates to migrating to and optimizing the cloud. So, broadly speaking, where do you think healthcare organizations come in that context? Are they, working hard or hardly working to get to the right place with cloud?
Yeah, I mean, it's no secret that, healthcare is sort of slow to adopt what other industries take on. And so compared to other industries, healthcare has definitely been slow to adopt the modern cloud strategies. But we are definitely seeing an increased prioritization of that and developing a solid hybrid cloud strategy among our customers. And I think, the pandemic shift out of necessity, right, it caused these health systems to figure out how to rapidly connect people and technology and data in completely new ways. So I think that was sort of the initial push that we've seen over the last few years. And as healthcare innovation continued, leaders realized, digital transformation really does require a shift, moving more workloads to the cloud and putting workloads, in a hybrid environment that makes the most sense. And I think particularly with the surge of AI use cases and, the big data analytics use cases, organizations are tasked with making this data and the applications available to a variety of end users, that being another, impetus to move more workloads and data to the cloud.
Well, so Jack, with the context that Dr. Cordes just shared about healthcare, what have we at Worldwide Technology learned from other organizations and other verticals about their cloud journeys that can really help healthcare organizations move forward more effectively and more efficiently in their cloud journeys?
Yeah, I think, Dr. Cordes, you said a couple really key things there. And one that kept coming, I think you said 2 or 3 times, was hybrid. Early stages of cloud, we would say 10, 15 years ago, there was cloud first or all in, or you heard organizations that were just making a rush to move to the cloud as fast as they could. And a lot of those organizations found, it maybe wasn't exactly what they thought it would be, and have now reverted to a true hybrid strategy, even involving multi-cloud in many cases. And so I think the benefit healthcare organizations will find, by being a little bit slower to adapt or taking their time to move into the cloud, is that they're able to, benefit from the learnings of some of those early stage all-in customers. That hybrid probably is the right strategy, especially in a healthcare organization, and it'll help them be more successful as they move more workloads into the cloud.
Yeah, and to add to that a little bit, I think that that whole strategy, that's a big undertaking, right? And, we're working with a large academic research organization, and they have unique needs in addition to what the community health systems are doing, where they have to really collaborate, not just internally, but across organizations. So with research facilities and even pharmaceutical companies, medical schools. So, we're helping one of these clients right now with that journey and really taking an intentional approach. Step one, what's the strategy? What are the use cases? And, where do we want to be? And sometimes that phase one is, Jack and his team know can be, time consuming. But I think investing that up front before we jump into, one of the others Jack mentioned is key.
Absolutely. I think the most important part of any organization trying to move into the cloud is properly defining that strategy, exactly like you just said. It can take a little bit more time up front, but without defining migration strategies, application strategies, data strategies, security strategies, even organizational strategies on how you're going to manage this new environment, you'll find that you'll more than likely stall out at some point and have to go back and do that work, which is much more difficult after you've already got workloads running in the cloud. So absolutely right. Cloud strategy up front, one of the most important aspects.
Well, I'm curious if there are any added complexities for healthcare organizations considering the staggering amount of data that gets produced in healthcare. I mean, I've seen reports that, upwards of a third of the world's data is in the healthcare vertical. So how does that affect the plans around cloud and the work that these organizations do?
Yes, I mean, it used to be until recently, many health systems were just too big to migrate. For example, their EHR systems, Epic particularly comes to mind, very concerned about the size of hosting these in the cloud, and also concerned about PHI. I mean, that's obviously been, sensitive data is a huge complexity unique to healthcare, financial as well. But I think we're in a different ballpark with healthcare and patient data. And so, but we're definitely seeing a shift where the hyperscalers, they're creating more specialized products for healthcare organizations with some significant sizing increases, and they're working directly with the EHR companies. Again, I mentioned Epic, for example. Mount Sinai, they worked with on Azure to be able to move Epic there successfully, and I think it's like 50 million database accesses per second was the requirement, and that's been done now, right? So I think size was an issue, and then obviously security, and most of these hyperscalers are, ramping up their global security compliances and focusing on, HIPAA as well. And so that's one set of complexities to answer your question. And I also think the lack of buy-in for hybrid cloud in this industry has been a couple other things like talent. Most healthcare IT teams, they're just not up to speed on the whole cloud modernization process as, for example, retail or consumer industries. And so CISOs and leaders are really turning to, outside partners, quite frankly, like us, to help kind of augment teams and upskill and get them ready to be set up for success. And then obviously, elephant in the room, cost, right? So business cases are always kind of focused on near-term IT costs because they're budget dependent. And so we kind of get sticker shock. I hear, among clients when they start looking at that migration, but downstream costs, obviously, associated with the traditional models around data security and regulatory compliance and data access and speed. And, that sort of has started to challenge this thinking and causing people to look more at sort of long-term benefits as well.
Yeah. Even just to add to that, you hit on a couple parts that I think go back to the first question too, is what can we learn from some of the enterprise customers that have already moved into the cloud, to share with our healthcare customers. And, when it comes to data and complexity, in the same way we would say not all applications are made for the cloud and you should, move what makes sense. I think the same thing is true for data. A lot of times organizations will just see huge data repositories in the data center that they know they need to move into the cloud without properly, classifying or categorizing or even, assessing whether it needs to move to the cloud or not. And so by doing some of that work up front, which hopefully is a part of that strategy and planning that we discussed a second ago, you can save yourself by not moving things into the cloud that you're going to be paying for that probably could age out as they should on maybe existing on-premises hardware. And so those kind of decisions, if they're made up front, can prevent some of that sticker shock by not moving things in that you don't need to, and help reduce complexity because you're going through the exercise of properly classifying all that data that's in your existing environment today. So that's one thing that you said I would totally agree with. And the other too is each of those hyperscalers are creating their own industry solutions around this. So Microsoft has their Microsoft Cloud for healthcare. Google's even got MedLM now solution, specifically an AILM solution for healthcare. AWS has the same. And so I think we're seeing that the hyperscalers are aware of this challenge that the healthcare customers are going through and creating industry solutions for them to help them adopt it quicker and hopefully not be caught off guard by complexity or cost or things like that. So.
Well, that's cool, Jack. I was actually going to ask you if the cloud providers have a point of view on this too, so it's great to hear that they do.
Well, they want all that business, right?
What's that?
They want to move as much as they can and are building as many solutions as possible to make it easier for them to do it. So.
Well, it's a big market opportunity for them, and then for the organizations to sort of connect with them properly, right?
Right.
Yeah. Well, so, cloud adoption and optimization is not something that immediately jumps out as a path towards improved patient care. And I know organizations in the industry focus on that, but that's also okay because, Sanaz, you've mentioned to us that the organizations are really starting to see an added emphasis on clinician and practitioner experience too, right? Finding the balance between those. So how will cloud help take better care of nurses, physicians, and others in the industry, and why is that part important as well?
I think it comes back to just the underlying theme of the benefit of cloud, speed, flexibility, access. These things matter, in the workflow of day-to-day clinicians. We've got clinicians using applications remotely. Again, the pandemic kind of swung that into motion. And so, they need to access a myriad of applications or modules within applications in a timely manner to be able to care for their patients. And that's things like health records, imaging, diagnostic data, labs. And so just being able to access that more quickly and more holistically, more comprehensively, because a lot of times they can see, this piece of the health record, but then this piece is sort of siloed in another place, and you have to be on site to access X, Y, Z. And so really it helps with that. And also, again, after the pandemic, we've seen a surge, slowing down now, but in telemedicine, but the remote monitoring piece continues, right? Monitoring patients on devices elsewhere and not within the hospital wall. So, access to cloud-connected devices, that's a use case that's very important for the clinician workflow. And that's, again, all about access and data and storage and, flexibility. So, yeah, I think that, if we kind of put our heads around all the things cloud does in general, they definitely translate to how clinicians are going to be benefiting day to day.
Jack, anything to build on that? I mean, do you see from the, more that cloud point of view that it's kind of easier proposition to talk about how that affects the practitioner experience, or is it more of a balance between both sides, practitioner and patient?
When I think of what the cloud may be offering to some of the clinicians and healthcare customers, I even think of how AI services are becoming so readily available in the public clouds for them to access to, even if it's something as simple as like transcribing or providing easier access to intelligence on the patient records that are already in the cloud, or maybe connecting into different data sources. I think AWS alone has 90 different third-party data sources, from public health data to genome information to all these different data assets that, by having themselves or the healthcare organization leveraging AWS or in the cloud, or even Microsoft or Google, they have easier access into some of those third-party data sets. And so hopefully that's improving overall experience, helping get clinicians and patients and everybody feeling a little more complete care around everything that they need from their provider. So again, easier access, faster services available in the cloud. I think it's another big benefit that the cloud providers are providing.
Well, Jack, I want to build on that a little bit and ask you about, that balance between, in this case, we're talking about patient experience versus practitioner experience, but that really much maps up to the broader idea of kind of consumer experience versus employee experience. And I know you've talked to a lot of different verticals where both are important. So I wonder if you'd speak a little bit to how organizations think about balancing those, if one of the others a higher priority. Any examples of that you've experienced out in your work with our clients?
Yeah, absolutely. And WWT has quite a few case studies on this that we could even call to in the cloud space. I think of retail, where it's important to make sure that you're improving the client's experience. How can you make interacting with that customer as easy as possible, as efficient as possible, so you can move more clients through, but also make sure that they feel like they're taken care of. But in the same sense, you want to make sure that your employees feel like they have everything that they need to be able to support that customer as they're coming through and interacting with your company. Financial services, the same thing. Look at the explosion of mobile apps and access to trading and finances in your hand, provided from the cloud through a mobile application. They've got to continue to push innovation and provide great services to maintain that customer. But at the same time, you've got to have all of that access and ease for your employees. Good example, even just to double down on in financial services, maybe your customer, they need access to all that information in their hand. You want to provide full 360 view of their accounts and everything else that they have access to. And for your employee, you want to make sure that they've got the intelligence around that customer so that they're positioning the right add-on services, or that they're, making sure that they're talking to them in a more personalized way. And so that's, I think, what we're seeing in the healthcare too, is how do we provide the best experience for the patients, but also provide the most intelligence for the employees to interact with that patient. But Dr. Cortez, you may have more insights into that, maybe even than I do.
No, I mean, I think you covered it. I would say it's no joke that, we all know that the patient experience hasn't been at the top of the, experience talent show, forever, right? Like the patient portals are not good. The experience, being able to access different parts of your own health record has been, pretty bad, honestly, until we started putting an emphasis into this over the last decade. And so for a patient, they don't really care what's happening behind the scenes. They just want to go to that digital entry point, right, the mobile app, and be able to get access. And so that is huge. And with the disruptors coming on with Amazon and big tech and retailers doing a better job at offering that, right? I think it's turning the knob up a little bit where, health systems realize that, like you said, for digital innovation and transformation to happen, to transform that patient experience, they can't have these sort of disjointed, on-premises sources of data that can't, be integrated or talk to each other and just present as a unified front to the patient.
Well, based on our conversation today, it sounds like there's still a lot of work to be done for the healthcare industry in general as it relates to adopting and optimizing cloud, and that's great. I mean, there lots of industries are working on that too. But I do want to ask each of you to kind of get out your crystal ball, wave that magic wand, and give us a glimpse into the future that you see. So what should healthcare IT leaders be expecting in the next 12 months, 24 months, or any time thereafter as it relates to cloud? And what should they be prioritizing now to stay in the game and really be prepared for the future that you envision for healthcare?
I can take that first part of that. We definitely know that we're going to see many more health systems hosting Epic and other EHRs in the cloud. I think mid last year, Epic published that there were 100 customers that are hosting on Epic's private cloud, but only 6 in the public cloud. And we seem to be having conversations, almost weekly with health systems now who are considering moving part of their clinical applications, into the public cloud. And so I definitely think we're going to see an increase in that, again, especially with the hyperscalers offering these more attractive industry-specific offerings. But I'll defer to Jack to kind of dive into what clients should do to get ready, tech teams should be doing to get ready.
Yeah, and I'll even start with where you left off there. I think we're going to continue to see the hyperscalers especially invest more time, energy, and money into building industry-specific solutions. So that industry cloud concept, I think we'll continue to see innovation around. Additionally, if healthcare organizations, or really any organization, knows that they're going to be moving into the cloud, and this is something that's a part of their 18 to 24-month strategy, getting a plan together right now for data security, migration, how to really take on a cloud operating model type of internal processes and really take that on as a company to make sure that you're ready for the new way of interacting with consumption-based finances and scalable infrastructure that comes up and down. So I think it's about planning and building the operating model now into your organization so you're able to leverage the cloud to its full potential as it's deployed. I think additionally, looking into personal and program development around skills training, you brought it up earlier, making sure that their people are ready to handle this new technology that's going to be coming in to the organization is something that they should be focused on. And then Matt, back to your crystal ball, I think in addition to seeing innovation from the hyperscalers around industry clouds, we'll continue to see more AI innovation and access to services, just almost as SaaS solutions in these hyperscalers that organizations can plug into, so they're not having to build all of this on their own. It's just ready and available to them in the cloud. So.
All right, as always, great insights from both of you. Thank you so much for joining us today and spending some time. Sanaz, Jack, thanks for being here.
Thanks for having us.
Yeah, thanks, Matt.
Yeah, and thank you for coming as well. Another great episode of WWT Experts. And one of the four-part series that we have on healthcare. So if you enjoyed this, please tune in to artificial intelligence, digital transformation, and security discussions that we have with Dr. Cordes and other experts in those areas from our business. And a great catalog of WWT Presents events that you can check out anytime. WWT.com/events to see the calendar of what's coming up, the back catalog that you can watch on demand at any time. And that is a wrap for our show today. Thanks for coming, and we'll see you next time.